51, injury in a pool, 55760 West Penrose Boulevard. 55760 West Penrose Boulevard. Cross Street, Beckerman. Time of 11:21.
5110 for KMG 365.
Hi, I'm Tim McKeska with Taylor Heartsaver. My first video for Taylor Heartsaver was going to be about the history of what I did 40 years ago that started this, how I trained the citizens of Taylor and East Williamson County. But we're going to have to wait and do that later. We have something more important to talk about right now. So many people have been saved by Naloxone, an amazing medication with the potential to change the epidemic of opioid overdose in our country. Americans are dying every day due to accidental opioid overdose, but now we have something that can bring them back from this critical situation of someone taking too much of a prescribed medication, too much heroin, or an accidental combination of too much medication. Recently here in Central Texas, we have seen an increase in fentanyl-laced social drugs, which is sometimes made to look like harmless candy. We have seen on the news how often this is fatal and how tragic it is, especially with Halloween coming up and what can happen. What's in this simple kit right here can save your life and save your loved one's life, and for anyone that may need it in an emergency. It's very simple to use, and I'll demonstrate it.
What is naloxone? Naloxone is a life-saving medication when given in time that can reverse an overdose from opioids, including heroin, fentanyl, and prescription opioid medications. Naloxone is an easy to use and small to carry. There are two forms of naloxone that anyone can use without medical training or authorization: pre-filled nasal spray, which we'll show you here, or injectable. Naloxone quickly reverses an overdose by blocking the effects of opioids. It can restore normal breathing within 2 to 3 minutes in a person whose breathing has slowed or even stopped as a result of an opioid overdose. More than one dosage of naloxone may be required when stronger opioids like fentanyl are involved. Naloxone won't harm someone if they're overdosing on drugs other than opioids, so it's always best to use it if you think someone is overdosing. Recognizing the signs of an opioid overdose can save a life. Here are some things to look for: small, constricted, pinpoint pupils, falling asleep or losing consciousness, slow, weak, or no breathing, choking or gurgling sounds, a limp body, cold and or clammy skin, discolored skin, especially in the lips and in the nails. If you have someone who is unconscious, not responsive, the very first thing you do is dial 911. Activate the emergency system. With the dispatcher, it's important that you explain your location accurately. Tell them what you've done for the victim at this time, and note the time and how many doses of naloxone you've given, and stay with that victim until emergency help arrives. Never leave that victim. Naloxone comes in a 2-inhaler package. This can be purchased at your local pharmacy without a prescription. CVS here in Taylor, Texas carries it. When you have a patient that you suspect has all of those signs and symptoms, or some of those signs and symptoms that I mentioned earlier, it's time to administer the naloxone. Remove it from the package. It is already primed and ready. Nothing needs to be done to it. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the bottom of the person's nose. Press the plunger firmly to give the dose of naloxone. Remove the spray from the nostril after giving the dose. If there is no response from the victim in 3 minutes, repeat the dose with the other package. Do not leave the victim until help arrives. If you know CPR, even if it's hands only, be prepared to give it. Monitor the victim closely. Turn them on their side with their hands under their head to support them, and monitor them until help arrives.
So, that's naloxone. If you're interested in learning more about CPR, basic life support, heart code, Heartsaver, first aid, OSHA training, please look at taylorheartsaver.org. Let me help train you, and let's get this tragedy under control. Let's stop opioid overdoses with a simple kit right here. It's very important. For Taylor Heartsaver, I'm Tim McKeska. Thank you.